Welcome to the podcast entitled Health and Wellness Briefs, Tactics for a Better You. I'm Dr. Megan Amaya, Associate Clinical Professor and Director of Health Promotion and Wellness at The Ohio State University. This podcast series is brought to you by Buckeye Wellness in the Office of the Chief Wellness Officer to provide you with evidence-based micro-learning modules to optimize your personal health and well-being. Our podcast starts by giving gratitude to someone or something in your life. Gratitude is one of the simplest research-based strategies to improve your health, happiness, and well-being. Please take a few moments right now to think about who or what you are grateful for today. Our topic today is heart health. February is celebrated as American Heart Month, and my guest is Dr. Laxmi Mehta from the Ohio State University's Wexner Medical Center. Dr. Mehta is a non-invasive cardiologist and professor of medicine in the Division of Cardiovascular Medicine at the Wexner Medical Center. Dr. Mehta holds an endowed chair position in women's cardiovascular health and is section director of preventative cardiology and women's cardiovascular health at Ohio State. She is also vice chair of wellness for the Department of Internal Medicine, chief well-being liaison, and faculty director of what we call at Ohio State the Gabby Health and Wellness Program in the medical center. Dr. Mehta specializes in well-being and burnout, both in the professional area as well as the professional, because they go hand in hand together, as well as cardiovascular prevention, women's cardiovascular health, and cardiac imaging. Dr. Mehta, I am thrilled to have you on our podcast today to talk about this very important topic. And just to set the stage, we hear messages all the time, all year round. It's not just in February, about how heart disease, it's the number one leading cause of death in the United States. Adults are affected, millions and millions of adults are affected by cardiovascular and heart disease. And so it seems like a lot of adults know what's going on. They're aware of it. We hear those stats year over year. And while the data may ebb and flow a little bit, it just repeats and repeats and repeats. And so the first question I'd like you to address, and love to hear any comments that you have on that piece that I just mentioned. If we're going to try to lower those rates and to impact the data in positive ways, who is at greatest risk for heart disease? And what are the warning signs and symptoms that us as adults should be watching for?
Yeah, that's a great question, Megan. And the concern is that I would say everyone is at risk for heart disease. Heart disease is not really picking and choosing the way we often think of. And so I think everyone's at greatest risk. I also want to say that, up until several years ago, the mortality rates or death rates from cardiovascular disease were really declining in the US, both for men and women. But in the last several years, it's rising. And just this week itself, they showed data that it's horrible. It's getting to rate. We've lost the last decade or so of movement that we've made in it. So that's why I say everyone's at risk. You're particularly at higher risk if you're diabetic and that's not properly controlled, especially if you have a family history of heart disease. If you have certain types of lipid conditions, that's going to put you at higher risk. Definitely, if you're leading unhealthy behaviors, biggest culprit would be if you're a smoker. And there's newer things such as pollution that's impacting it, stress and mental health conditions. So I don't think anyone's not at risk. I would say everyone's at risk, but certainly there are some that are at a little bit higher of a risk. When we think about the symptoms of heart disease, the symptoms, if you're having a heart attack, would be this crushing sort of chest pain, discomfort in the middle of the chest to the left side of the chest. It can radiate down the arm. You can get really sweaty with it. And that's what we typically think of heart disease and heart attack signs. But sometimes people can have different symptoms, especially women, but men too, can have the discomfort that feels like it's on their right side or in their back, or they may only come in with just new onset of intense shortness of breath. Some people, their heart symptoms are intense heartburn that's not getting better with antacids. So sometimes it can be confusing for patients what these symptoms are and what to look out for. So I usually tell people if there's something new that you're feeling and it's acute, seek medical attention. If you're not sure, better to just get tested anyhow. You don't want to miss a heart attack.
Great information. I want to go back to the comment here in a moment when you were just talking about how the rates we're trending in the wrong direction now. But before we do that, you're helping to answer the question of when is it time to go see your provider? And it sounds like there's a lot of variability there. I like to say we have guts and we have them for a reason. So to your point, if you notice something's off, yep, let's go in. But what you were describing there, gosh, it's really individual. There's common symptoms, but it seems like it's individual at the same time.
Yeah, and everyone does have guts, but then they also have minds and that say talk them out of it, or they have external obligations that then make them second guess and not prioritize their health. So that's where the challenge is of balancing it and making sure you kind of go with your gut feeling more than letting external factors like I've got to get to this soccer game or whatever that may be or and when it comes to going to a healthcare provider, obviously, if you think you're having a heart attack or stroke, you call 911. But if you're having symptoms that are not severe, they come and they go and you're at rest and slighter, call your physician's office and try to get in with your provider. But then people often think you have to go and be seen only when you're sick, and that's what we call health care. But I think that we should be thinking of healthy care and preventative care. And so you also need to just see your provider just to get overall risk assessment and to think, because there's some things that you don't even know you have till you get checked out. And it's just a good necessary step, like just like you take your car to get a tune-up or check those oil levels in the car. Same kind of thing for yourself.
I actually get excited when I go get my blood pressure taken. I know that sounds kind of silly, but I like to know that it's normal. It's important to me. So I'm all about getting my blood pressure taken. Okay, going back to the comment you made about trends are going in the wrong direction. What is the research data saying? Like, what are the contributing factors to what's been happening over the last several years?
I think, people are attributing it to the rise in the risk factors for cardiovascular disease, the sedentary lifestyle, the dietary things that are going on. So different things mechanistically that are being assumed. And certainly the pandemic didn't help people in terms of activity levels, diet, and things like that. So, but some of these changes were happening even before the pandemic because the data we have always lags a few years. It just reinforces that we need to really prioritize our health.
Yeah, absolutely. Same topic, just a little bit slightly different. You mentioned it here and there through your comments, the relationship between the genetics, the family history, and heart disease. What does the data show? What is that relationship between family genetics and your risk of heart disease?
Yeah, so, if you have a family history of, let's say, heart attacks or coronary artery disease, very high likelihood that you may develop that in your lifetime. And so it's not to shy away from it or to be scared of it and think the inevitable is going to happen. It's then using that knowledge to take the necessary preventative steps are going to be there. So we know if people have coronary artery disease, especially when it's at a young age in their family, higher risks of having that. We know like if your parents had high blood pressure at a young age or high cholesterol, that's going to happen. There's also other important things, certain types of cardiomyopathies or heart muscle issues and types of heart failure that can be genetic as well. And so people need to be tested for that and aneurysms of the heart. But what often happens is people and families like to keep medical history kind of quiet and secretive. And so you don't know about it. And so sometimes that's cultural, sometimes it's parents not wanting to scare their children or burden them and things like that. So I think like, when you're getting together with your family, you really do need to know that because knowing your family history is one of the important strengths that you can take to your doctor and important information to help aid in what is the kind of testing that needs to be done and what are the preventative steps that can be done for them. So knowledge is power.
I like how you called it healthy care early. Healthcare and healthy care. There is a difference. And that's that healthy care can really help lower your risk, find out what needs to be done especially if you do have a family history. All right, moving into ways in which, and we'll talk about prevention here in a little bit, but the treatments that are out there for heart disease. You've been in the field for a long time, and some of the time tested treatments that are used for heart disease. And what do you see on the horizon or some of the newer innovative treatments that are being used for heart disease?
Yeah, that's a great question. And the fun thing about cardiology is there's always things that are being developed or different things that can be done for the heart. I'll share the story of heart valve disease. So I was a cardiology fellow a little over 20 years ago and graduated 20 years. And at that time, when people had aortic valve stenosis, we were sending patients to open heart surgery, which means they get to have their sternum cracked open and several days like a week in the hospital to recover from the surgery. During my fellowship time, we were one of the first centers to start doing an innovative procedure called a TAVR. And so that's where we can, instead of doing the typical open heart surgery, we go in through the groin and take a valve in a catheter and balloon it up and open it up into your heart, like we do with stents. And it was really revolutionary at that time. And I remember my mentor telling me, this is going to be in the next 2 to 3 decades, it's just going to boom, this ability, and it's going to really change healthcare. And so in the last 2 decades since I finished fellowship, I've seen that it's expanded to not just in research trials, now to being used on a regular basis for patients and the number of patients that are getting it. There were a lot of trials and tribulations to get to that point. But what's also interesting is they didn't, the science didn't stop at just the aortic valve. Then that interested people to look at the other heart valves that are in the body. And isn't that kind of neat? Like, I know the intent is not to put the cardiothoracic surgeons out of business with stents and these transcutaneous valves. And so they're learning those techniques as well. But isn't it great for patients and their families to not have such an invasive procedure and to be able to go home sooner and to recover sooner? And get back to their lives much faster. And so that's exciting. And there's still so much innovation happening in the heart valve stuff. So stay tuned. And I tell people like, if you have a health condition, there are innovative researches that are going out here at The Ohio State University, Wexner Medical Center. And so look it up on the website. People can search the research trials and participate in them, whether it's heart or other conditions. It's open source, open access for people to look it up. So do recommend them to Google it and get on the Ohio State University Wexner Medical Center site.
Oh, that's cool. I don't think of that stuff very often. So that's a really important point that you mentioned. And as you were talking through that example, I'm like, oh my gosh, that's less hospital stay. That impact or that benefits the patients and the families, as you were mentioning. That also benefits the healthcare system when you can get patients moving along back to their normal routines faster and hopefully not having to come back in too. And so that I could see that has like a double and triple effect on what's going on with the patient and the healthcare system. So that's super fascinating.
Oh, absolutely. And the thing is we're in the baby boomers generation, right? And there's so many patients and hospital systems were overflowing with patients. Patients are waiting in emergency rooms long time. So, being able to the throughput of patients and getting them back to that healthy care is what we want to see. So yeah, makes a world of a
Yeah,
difference
very
for
good.
them.
So we've talked about warning signs and genetics a little bit and treatments. Let's talk about prevention, which is my sweet spot. It's behavior. And I like to say behavior is simple and not easy. And so if we talk about practical strategies, practical tools, practical behaviors that people can engage in to prevent heart disease, what would be your go-to in terms of recommendations?
So in terms of the practical things, I like to and I love that you do health promotion. So thank you for what you do. Buckeye Nation benefits from people like you. When I think of the preventative things, we like to think about it from the American Heart Association's point,
Mm.
where it's life's essential 8. And so there's the health behaviors and the health factors that can be done. So the health factors are seeing your provider to manage your blood pressure. So that means know your numbers and then it can be managed. Knowing and managing your blood sugar, knowing and managing your cholesterol. And I do want to say, when we think about cholesterol, do not look at what the normal values are when you get it on your readout of your lab, because everyone is unique on what your normal numbers need to be. And so talking to your physician about that, because depending on your conditions, we'll be a little aggressive about different numbers. And then the other health factor is knowing and managing the weight for what is healthy for you and not what is that healthy number is not what you see on Hollywood numbers. It's really what is, good for you. And then the health behaviors that we recommend is eating better, and eating better is hard, right? So always say to take those baby steps and make small changes at a time, which are more sustainable. The typical diet we'll recommend is a Mediterranean diet. If you want to go real aggressive, then it would be whole foods, plant-based diet. But reducing the red meats, the saturated meats, the fats in your diet is going to be essential. Getting more whole grains, fruits, and vegetables is essential. Drinking more water. We actually don't promote alcohol anymore. Other health behaviors, being more active, and activity means sustained modern intensity aerobic exercise for a total of 150 minutes a week, or vigorous exercise of 75 minutes a week. And that's separate from what you do in your day job, because people often like to say, well, I'm active during my day job. But a lot of times people are stop and go in what they're doing, even when they're walking at work. And so we need sustained activity of 10 minutes to add up to 150 a week.
Activity keeps the heart pumping, right?
Yep,
Get
heart
and the
pumping,
blood
heart rate.
flow and yeah, the cardiovascular benefits continue.
And then many of us have sedentary jobs, right? And especially with the IT boom that we have in technology. So I love, by the way, how you're standing for this podcast. The healthy behaviors is always great. The other health behavior is quitting tobacco and refraining from tobacco, and that means not just cigarettes and cigars. I'm talking about vaping and all the other chemicals. Even if there's no nicotine in it, I don't know what those chemicals are that you're inhaling. And then it's also not you just actively doing it, but it's secondhand smoke that's bad for you, and the pollution that you're surrounded by. And then the fourth healthy behavior is getting healthy sleep. So that's 7 to 9 hours of sleep per night. It's essential to do for your heart health. All of these behaviors are easier said than done. Absolutely. It's easy for me to prescribe it, hard for patients to do it. And so we always say to take those baby steps. A ninth thing that I do want to add on top of AHA's essential 8 is going to be mental health conditions. And I have a feeling that's probably going to get into their next number when they do their reiteration in a few years, is that mental health, whether it's depression or stress, negatively impacts our heart health. And there's certain conditions we see, as well as poorer health behaviors when people have that. So treating your mental health conditions, we need to destigmatize that and normalize the conversation of mental health is critical, because that impacts everything from the heart throughout your whole body.
100%. Just bravo to that one. I like to say stress stresses the heart. Stress stresses the cardiovascular system. It's all related in there. And I also have this, it's not really a saying, kind of like whole health starts with mental health. And when we feel better, meaning our emotions, our brains, which gets into that mental and emotional space, then that helps us engage in those other behaviors that you were mentioning, or stopping some of those behaviors. Because if we're stressed out and burned and have depressive symptoms, et cetera, we want to cope oftentimes in the things that aren't the healthiest for us. And so that mental and emotional is significant with this topic for sure. And I echo what you just, I hope that it's brought more into those pillars as American Heart moves forward. So that's terrific. Well, we're going to end here. I just have one last question for you. This has been fabulous and inspiring for me. If you had to summarize all of this, which I know is really challenging, what would be your take-home message for us in regards to heart health?
Number one is lead a healthy lifestyle with the health factors and behaviors that I talked about. Number two is really know your numbers and family history, but that too also requires you to see your healthcare provider, because part of knowing the numbers is them giving you those numbers. And three is whatever you are told about your heart health or your risk factors, it's not the end all be all. You can change your overall lifestyle and health trajectory. 80% of heart disease is preventable.
Hope with facts. There you go. Hope with facts. Dr. Mehta, thank you so much. This has been wonderful. Really appreciate your time and energy, your dedication to this field and to us as your patients, and also your expertise, because your guidance can help change lives. And we really appreciate all of that.
Well, thank you, Megan. You're doing great stuff for us at The Ohio State University and promoting healthy lifestyle. So thank you.